Yeah, so what I'm going to talk about today and next time is the association between mental illness and crime. I'm not going to go into too much detail on each of the disorders. Okay, it's not an abnormal psych class, right? We're mainly focusing on the association between these disorders and crime. But you know, I believe you're all seniors, and most of the seniors have taken abnormal psych, so you probably already have a good idea on some of these disorders. What I want to do first of all is present an argument that Rain lays out in 1993, which is that recidivistic violent offending constitutes what we would call as a disorder based upon how it's technically defined. Okay, so here are some of the common ways that we use to define something as a disorder. I'm going to talk about these individually, but does it deviate from what's statistically normal? Does it cause distress and suffering to the person or to others? Is there a biological dysfunction associated with it? Is listed in the DSM. Okay, some of these are more complete, more valid, okay, more practical maybe than others, okay, but these are 9 common criteria, okay, used to define something as a disorder or not. So, first of all, deviation from what's statistically normal, okay? Schizophrenia, for example, is a good example of something that is statistically abnormal, okay? 1% of people have this disorder. But there's plenty of disorders listed in the DSM that aren't quite as rare as this, okay? Schizotypal personality disorder, which I'll talk more about, but it's kind of like a more mild form of schizophrenia. It's about 3% of the population, okay? With schizophrenia, you hear and see things that aren't there, right? With schizotypal personality, you might misconstrue whispering as someone talking, or a shadow as something that's actually moving. Depression, the rates on this differ quite a lot based upon whether we go with clinical diagnoses or self-reports, but usually the figures are about 20% of people will have depression at some point. And then alcohol dependence, substance abuse disorders, or like around 13%. Okay. So quite variability here, okay? Some are much more rare, more statistically abnormal than others. What about crime? Well, if we looked at crime in general, about 10% of males have some sort of criminal offense, okay? That includes misdemeanors and non-violent offenses. 2.5% to 3% of men have some violent criminal offense, okay? But what if we just focus on the recidivistic violent offenders, okay? Those who repeat a number of offenses or in and out of the system. Well, what we know from research is actually that a very small percentage commits a very large percentage of crimes. One of the best illustrations of this is that in a study in Denmark, 1% of a sample in Copenhagen was responsible for 50% of the crimes committed. Now, if we look more broadly at the forensic population, we know that about 85% have antisocial personality disorder. We know that a smaller number have psychopathy, okay, about 15%. And psychopathy is one of the best predictors of recidivism, okay, that predicts in and out of prison, okay, a kind of lifelong criminal career. So we are talking here about the extreme end, okay, who are committing a large proportion of the crimes. The second one is that it deviates from what we call ideal mental health, okay, or what the humanists would have said is differing from self-actualization, no longer on the path to being all that you can be and trying to better and understand yourself. The humanistic theories, people are naturally drawn towards bettering themselves and flourishing. Okay, well, that's the natural pathway of human progression. And if one steers away from this, then something must have gone wrong with their basic needs or their self-worth, or the natural progression must have been disrupted in some way, right? Well, this one's pretty simple, right? We would agree that career criminals are not self-actualizers, right? They're not on the pathway, okay, to being the very best version of themselves and what we would really consider to be ideal mental health. A deviation from social norms. Well, this one's also very simple, right? Obviously, crime is not socially acceptable. Otherwise, it wouldn't be a crime, right? Because it's not socially acceptable, because it's harmful to other people. That's why we consider it a crime. That's why it comes with punishments. And if a behavior is no longer viewed as deviant, then it's no longer viewed as a disorder. And the next one's pretty simple too, right? It's a disorder if it causes stress to the self or to others. This is usually a pretty powerful, predictor of a disorder. It's extending the fact that suffering can be not just suffering for the person, but with some disorders such as schizophrenia, alcoholism, can cause suffering for loved ones and those close to them as well. Now, crime obviously causes suffering to others, right? Again, that's why it's considered a crime. That's why it comes with punishments, because it's doing something harmful to other people. It's causing other people distress or taking something that belongs to someone else. But actually, also, we could argue that it causes suffering and distress to the criminal as well, at least in most cases, right? Criminals are more likely to have a lower life expectancy than non-criminals. They're more likely to have a whole bunch of life stressors, more likely to have substance abuse disorders, more likely to be homeless, more likely to have a number of cognitive impairments, more likely to experience social isolation, and more likely also to be victimized themselves, be victims of crime as well. So again, a pretty straightforward one, right? Yeah. Okay.
You say more likely to be like a victim of a crime. Is that just in the sense of like they're more around people who like would commit crimes, so they're more like vulnerable in that sense?
I mean, there's a whole bunch of factors, right? It might be that some crimes are retaliation. It might be the case that, like you say, they're in environments in which they're more likely to be victims of crime. They're interacting with people who are more likely to take advantage of them. There's actually a number of reasons for it.
Everything.
Yeah, exactly, yeah. The fifth one is seeking out treatments. Okay, that's one way of defining that something is a disorder. Usually, again, a pretty powerful predictor, and it's extending from the previous point that if someone is experiencing distress, then they're going to seek out help and treatment for it. Now, this one is not a match, right? Criminals don't seek out treatment for being criminals. Okay, and if we look at the most relevant disorders to recidivistic crime, like psychopathy, narcissism, these are the personality disorders that if people have, they're least likely to seek out help for, least likely to seek out treatment. Number 6, that it causes some impairment with their functioning or their kind of efficiency in life. Again, using this kind of medical model approach that it's having a negative impact on their social experiences, their ability to form relationships, maintain friendships, impairing their social skills, and impairing their ability to hold down a job. It could cause a number of behavioral disturbances, right, or psychological disturbances, cognitive impairments, have a negative impact in their school period as well. Now, if we relate this to criminals, we've already looked at the fact, right, that criminals are more likely to be cognitively impaired, lower IQ on average, are more likely to do poorer in school, have a number of negative experiences in school, more likely to have learning deficits. They are more likely to do worse on executive function tasks and neuropsychological tasks. And this corresponds also with brain deficits that we've looked at, right? Damage to the frontal lobe, particularly. We also see that criminals usually do have impaired social skills. Now, this differs depending upon the crime that we're talking about, so it relates to some more than others, okay? But usually they're not the best at resolving conflicts. They're not usually the best at expressing themselves in a healthy way, okay? And often also does come with difficulties holding down a job as well, right? And then, like I said, more likely to have a lower life expectancy, okay? In one study, 4.5 times more likely to die prematurely than non-criminals. What about number 7? Listed in the DSM. Okay, now obviously we know recidivistic crime isn't listed in the DSM. Okay, Antisocial personality disorder, though, must overlap pretty significantly if 85% of offenders have antisocial personality disorder. Okay. Conduct disorder is a kind of precursor, usually, to antisocial personality disorder, right? Diagnosed in children, very often does predict adult antisocial personality disorder. Substance abuse disorder often facilitates criminal behavior, right? An intermittent explosive disorder in which one has difficulty regulating their emotions and are pretty prone to outbursts of rage and explosions because of their temper. And then a whole bunch of disorders listed in the DSM also, but these ones are more tied to specific crimes, right? Sexual sadism, only feeling sexually aroused if you're causing physical pain to someone else, such as torturing. Kleptomania, a compulsion to steal, right? You don't have to know all of these definitions, by the way. I'm just giving you some examples of related ideas that are listed in the DSM. Pyromania, a compulsion to set fires, right? Pedophilia, sexual disorder now, a sexual preference for children, not yet adolescents. Exhibitionism, compulsion to show your genitals in public. Frotterism, a compulsion to touch someone else's genitals without their consent. So, cases such as people rubbing up against someone in the subway without their consent. And then voyeurism, stalking and spying on someone else, and without them knowing that they're being spied on, that's giving you some thrill and excitement. So, some related disorders to crime, right, that are listed in the DSM. But if recidivistic crime isn't listed in the DSM, does it match the definition of a disorder in the DSM? So this would be, clinically significant behavioral or psychological syndrome. So again, it can be something that's mentally experienced or something that's evident through behavioral actions. It's associated with distress, disability, increased risk of suffering or death, pain, disability, or a loss of freedom. Well, we've just looked at a number of points of evidence, right, that at least a number of these are a match. And then, yes, a manifestation of behavioral, psychological, or biological dysfunctions. So that would be the last point here that could be used to determine something as a disorder. Is it caused by a biological dysfunction, or at least closely tied to a biological dysfunction? Now, we've looked at a number of biological irregularities, right, in offenders. We can't say that these are causes of recidivistic crime, because there's so many predictors that go into that, and a number of these findings are correlational, rather. But we've looked at the fact that their arousal levels are lower, right? Their psychophysiology is different. Brain imaging studies tell us there's neurological differences, right? And they perform differently on neuropsychological tests. And then there's hormonal and neurotransmitter differences, genetic differences as well, right? So there's a whole range of biological factors that we've looked at. So does recidivistic crime, therefore, meet the technical definition of a disorder using these? Well, I think at least most of these, it's a pretty good match, right? The only real exception is seeking out treatment. Okay, that's obviously not a match. But if we compare this to other disorders listed in the DSM, schizophrenia matches all of these pretty much very well, with the exception, again, of seeking treatment. Okay, if you have schizophrenia and maybe you're delusional, you don't know you're delusional, so you won't seek out treatment, obviously, in many cases. But there's a lot of disorders in the DSM that don't match all of these, okay, quite as well as schizophrenia does. Schizotypal, for example, much more moderate in terms of the distress and suffering it's been found to have on someone's life. Again, people don't usually seek out treatment for this. Schizotypal is usually only diagnosed if people are given self-report questionnaires, and in many cases at random, okay, and then they discover through this that they have this disorder. It's not often something that someone knows that they actually have a disorder, okay, it's usually kind of news to them once they find out. It's something that they don't really seek out treatment for. And then What about caffeine use disorder? Okay, statistically not really that abnormal. Okay, doesn't really demonstrate much deviation from social norms. Okay, it's pretty socially acceptable to drink coffee, right? Even a lot of coffee. Doesn't really cause major distress on your life or the life of others. Okay, so this one's listed in the DSM. It doesn't really match these points. Okay, arguably anywhere near as well as recidivistic crime does. Okay, now that's one point. Okay, that maybe recidivistic crime does technically match the definitions of a disorder, but it's a different question over whether it should actually be conceptualized as a disorder, because that comes with a whole range of implications and so on. So what I'd like you to do in small groups of maybe 3, answer this question, okay? Do you think that we should reconceptualize recidivistic crime as a clinical disorder? And see if in your groups you can reach a consensus, an answer that you can agree upon on whether you think it does merit being conceptualized this way, or you don't think it should be. Now, I could give you a number of examples of how the forensic population are more likely to have mental disorders, okay, than the general public. Okay, true across the board, from mood disorders to anxiety disorders to personality disorders. Okay, but one question might be, well, do these actually predate the criminal behavior? Or maybe is it the case that, if you're living a criminal lifestyle, and then maybe also if you're being, measured later on when you're in prison, then maybe these experiences are what's contributing to a negative mental health, right? So the question might be, do these mental disorders actually predate criminal behavior? So there's a longitudinal study that illustrates this pretty well from North Carolina. Over 1,400 children, ages 9, 11, 13, assessed for various disorders, and then followed up to age 16, okay, to see if they commit a crime after the age of 16. Now, what we have here is the odds ratio, okay, meaning that what we're doing is we are comparing those who have this disorder versus those who don't, okay, to see how more likely those with the disorder were to become a violent offender. Now, half of the adult offenders had some disorder, okay, listed during one of these earlier observations, okay, when they were children, okay. So for half of the offenders, it did predate the criminal behavior, okay, there was some early emerging disorder. And we see here a breakdown in terms of how much the odds are increased, okay, in terms of committing a violent crime by having one of these disorders. So a conduct disorder on its own was the biggest predictor, not surprising, okay, because it's a precursor to antisocial personality disorder. Increased the odds by 5, okay, that the individual would commit violent offense in comparison to those who didn't have this disorder. A substance abuse disorder increasing 3.5. ADHD increasing the odds by 2.2. Depression increasing the odds by 2.3. But we get better predictors if we look at a combination of disorders, okay? So the biggest one here is depression plus a substance abuse disorder, increasing the odds then by 12.6. Anxiety and a substance abuse disorder, 9.5. Depression, conduct disorder, about 6. Anxiety and conduct disorder, about 7. Now, it might be fairly small samples, okay, within these groups here who have both conditions. So we should bear that in mind before making big generalizations. But even with that in mind, there still seems to be pretty good evidence that in many cases, a mental disorder does predate the criminal behavior. It's not purely a consequence of the criminal lifestyle. So I'll talk about some of these disorders individually. ADHD, first of all. So listed in the DSM-5, its symptoms are split into 2 categories. A category to do with inattention, right, which means being easily distracted, being forgetful, failing to finish your work, making careless mistakes. And then a category that's to do with hyperactivity, right? So this would be always interrupting, all constant fidgeting, right, leaving one seat constantly. Now, in order to be diagnosed with this using the DSM, usually more than 6 of these have to be present, okay, in total, okay? So it could be from both categories, it could be just from one. In most cases, it's from a combination, okay, from both categories. The onset must be before age 12. There must be symptoms in at least 2 settings, okay? So it's not the case that these symptoms are only observed at school or only at the home. They must be observed in more than one context. And the symptoms must interfere, okay, with one's academic success, their social abilities, or maybe occupational functioning if we're looking at older individuals. And then, yes, they can be, inattentive or hyperactive or both, right? They can load onto one or, as is usually the case, onto both. So what's some features of ADHD? Well, about 5% of children have ADHD. It's rarer in adults, okay? About 2.5% are diagnosed. And it's much more common in boys, right? Twice as likely, in fact, that boys will have it versus girls in childhood. If we look at adults, the sex difference isn't quite as large, okay, but it's still pretty significant, okay? 1.6 males have ADHD for every female who has ADHD. And what we find from twin studies is heritability is high for ADHD. In identical twin studies, okay, separated at birth, okay, the heritability ranges from about 75 to 80%, okay? So there is some biological or genetic, okay, influence on this disorder. And as you're maybe aware, there's been a large increase in ADHD rates, right? From 2008 to 2018, there was a 41% increase. Now, this could be because of more awareness, more diagnoses. Also, it could be because of differences in stimulation for children as they're developing. There's no universally agreed upon answers, right? There's just theories really as to why it's having such a larger rate now. But there's probably a whole range of contributors into it. Now, what we find is that ADHD coexists with 2 disorders, in particularly relevant to what we're talking about in its relation to criminal behavior. Conduct disorder, or ODD, oppositional defiance disorder. How many of you have taken abnormal psych? Most of you. Do you know the difference between CD and ODD? So both are to do with not wanting to be controlled and disregarding the rules, right? But the way that I would explain the difference most simply is that for those with a conduct disorder, not only do they not want to be controlled, but they want to control others. Okay, there's lots to do with power and dominance and status. Okay, whereas for oppositional defiance disorder, they're not concerned about controlling others. Okay, they just don't like to be controlled. They're very rebellious in terms of their behavior, but they don't have the same thoughts over wanting to have power over others and concerns to do with status and dominance. Okay, that's probably the main distinction. So, ODD and CD coexist in many cases, about 35 to 45% of the time. Okay, and in terms of how more likely one is to have at least one of these disorders if they have ADHD, some meta-analyses have addressed this. 1 of 21 studies. Well, those with ADHD were 10 times more likely to have one of these disorders than non-ADHDs. And another meta-analysis, this time just looking at the girls, okay, similar, those with ADHD, about 9 times more likely to have conduct disorder, well, between 5 and 6 times more likely to have ODD. We have a study here looking at over 4,000 children, age 9, with ADHD, in a comparison to controls, and then we're measuring criminal conviction rates at age 22. 32% of the ADHD sample had a criminal conviction by age 22 versus 15.6% of the control group. So the conclusion of that was therefore that having ADHD increased the odds by 3, okay, that one would have a criminal offense. So why might it be the case that there's some overlap between ADHD and these two disorders, or why is it that they coexist quite so frequently? First of all, they both are heavily to do with stimulation seeking and low levels of arousal. Okay, across these disorders, there's reports of wanting to seek out thrills and excitement and experience some increase in arousal, okay, through stimulation seeking. But also, all of them are somewhat associated with neurological differences, okay, that quite often have the same risk factors, okay, meaning that there's been some disruption, okay, to brain development. So all of them, for example, have been linked to lead exposure, okay, during brain development. There's also some common genes, okay, being found to be found more likely in those across these disorders. Impulsivity has been found to be highly heritable, and impulsivity also is a crucial component of all of these conditions, okay? So again, that might be explaining some of the overlap here. Executive functioning deficits found in those with ADHD and in those with ODD, okay? And we've looked at the fact, right, that in criminal behaviors as well. Also, in both of these conditions, we have impairments in recognizing emotions through facial recognition tasks. And then again, some similar risk factors, okay? Negative peer experiences like peer rejection early in life, negative parenting styles, low socioeconomic status, okay? So again, some similar risk factors for these conditions. And then probably the disorder that's linked to criminal behavior most often is schizophrenia, but particularly paranoid schizophrenia, which is why I'm going to use the DSM-4 instead of the DSM-5 here, because the DSM-4 categorized schizophrenics into different types of schizophrenics. Okay, one of which was paranoid schizophrenics, okay, which has been found to be the most linked to criminal behavior. The DSM-5 doesn't make this distinction. So, in the DSM-4, we have at least 2 of these symptoms in a month period, okay, in order for it to constitute schizophrenia. So this might mean delusions, hallucinations, disorganized speech, ketonic behavior, seeming unresponsive, flat affect, so complete lack of emotions, right, never really emotionally reacting to anything in one's environment. It's having a negative impact on your self-care, your social skills, your social life, your occupational life. And then, continuous signs for at least 6 months in terms of making the diagnosis. But it's not the case that if one has schizophrenic, the symptoms are always continuous, okay, beyond this 6-month period. Because, with schizophrenia, there's usually a dormant stage, okay, in which the symptoms are present. And then there comes an active stage, okay, in which, through one's behavior and through one's speech and so on, the symptoms are evident. And then quite often there comes then a residual phase, okay, in which, again, the symptoms decline. And this is quite often when, people with schizophrenia think that they're all better, and sometimes they go off their medication or they stop taking treatment and stop seeking help and so on. And then comes another active stage, okay, in which the symptoms again come to the surface. I want to share a video with you. You'll find on the link a whole bunch of videos on this, but I'll show you just this woman's TED Talk in which she talks about her experience with schizophrenia, okay? And then after that, we'll talk about some of the symptoms and experiences and how they might predispose to criminal behavior. So, schizophrenia is probably the disorder most tied to criminal behavior when it's untreated, unmedicated, and when it's paranoid schizophrenia, especially. So in one large sample investigating this, we have more than 350,000 participants. And then we have split into males and females based upon these offenses. How much more likely were they to commit them, okay, in comparison to controls? Okay, so again, we're looking at odds ratios here. So in terms of having schizophrenia increasing the odds of violence against authority, for males, we're finding between 3 and 4 increase, okay? For females, nearly increasing the odds by 12, okay? For assaults, 2, 7, robbery, 3, the females here not significant. Rape, only for the males is significant, finding that increasing almost by 3. And then for murder, okay, increasing the odds in the male schizophrenics by nearly 3, and by more than 22, okay, for the female schizophrenics. Now, keep in mind that women are much less likely to commit murder than males, of course. So if we find a risk factor that does increase the odds, it's going to have even more impact, okay, on the female sample than the male sample. This does not mean that the female schizophrenics are more likely to commit murder than the male schizophrenics, okay? Because this is in comparison to other males, and this is in comparison to other females, okay? Just so that's clear. So significantly increasing the odds, but let me make a quick point that, you know, if we're saying that about 3% of males commit a violent offense, okay, and having schizophrenia maybe triples the odds, okay, that's about 9%, okay, of males with schizophrenia might commit a violent offense. That's still meaning that the vast majority of males with schizophrenia don't commit violent offenses, okay? So we have to keep that in mind. Those with a mental illness are much more likely to be a victim of a crime, okay, than they are to be an offender. With some crimes, like having property stolen, schizophrenics are about 60 times more likely to be a victim than a member of the general public who's without a disorder. So keep that in mind so that we're not, you know, stigmatizing those with mental illness or claiming that it's, you know, always going to cause criminal behavior. It certainly isn't. Okay, we're talking about a minority of cases. Again, looking at the males in terms of increasing the odds of committing a violent crime, if we control for other environmental factors like, you know, socioeconomic status or whether they're single or divorced, because that might all have an impact on, you know, how they respond to situations and their kind of well-being, a whole range of other factors. We're finding it increases the odds by more than 2, okay, that they'll commit a violent offense, they have schizophrenia, even when controlling for these potential confounds, right? Because obviously those with schizophrenia with a disorder are usually more likely, okay, to have struggles with interpersonal, with relationships and so on. And if we control for alcohol, drug disorders, and other personality disorders, because again, a lot of disorders, you know, coexist with each other, we're still finding that it increases the odds by about 1.5, okay? And similar with females, okay, controlling for these environmental experiences, increasing the odds by nearly 8, okay? And increasing the odds by more than 3 if we control for these other potential confounds like substance abuse disorder and personality disorder.
So the ones in the dark blue, just to clarify, it's they don't have schizophrenia, but they have exhibited violent tendencies, or
so this is a sample of those with schizophrenia, and then a random sample who don't have schizophrenia, and then how many of them have committed a violent offense. So we have about 3% of the controls, which is about what we would expect, and then nearly 12% of the schizophrenic sample. Anything else? In one large meta-analysis on this, they found that having schizophrenia increased the odds by 4 in males that they would commit an act of violence. In females, nearly 8 odds increase. Looking at just homicide, which was 5 studies for both males and females collectively, raising the odds by about 20, okay? And if we looked at having schizophrenia in conjunction with having a substance abuse disorder, then the odds increase in males was nearly 9, okay, in comparison to 4 if it's just schizophrenia without the substance abuse disorder, right? And about 20 in females, okay, versus about 8 if the females have schizophrenia but without the substance abuse disorder. Okay. So these two together increasing the odds even more dramatically so. But what I showed you before was all schizophrenics versus the general public, okay? Or, you know, those without schizophrenia, I should say. But if we look at different types of schizophrenia using the DSM-4, as I said, paranoid schizophrenia is the one that's most linked to criminal behavior. So this time we have the green bar as the paranoid schizophrenics, and the blue bar is all the other types of schizophrenics, okay, the non-paranoid types. And even in comparison to the other schizophrenics, when controlling for these factors, the odds increase for violence is but 1.7. Okay, so that's still a significant increased likelihood of committing violence in comparison to the other types of schizophrenia. And for the females, 3.3. Okay, so again, a significant increase. I want to go back now to some of the disorders that we were talking about individually. So I finished last time talking about schizophrenia, which is one of the most tied to criminal behavior, right? So what about schizotypal personality disorder? You know, sometimes regarded as a kind of mild or form of schizophrenia. So in the DSM, it's characterized as a cognitive perceptual distortion disorder, including eccentric behavior, interpersonal deficits, and 5 or more of these symptoms, okay? Issues with ideas of reference. I'm going to give some particular examples of what that looks like. Odd thinking, speech, odd eccentric behavior, excessive social anxiety. And then, of course, these must not be due to some other disorder. So there is a self-report questionnaire for measuring schizotypal personality. The items load onto 3 factors. The first factor is to do with cognitive perceptual issues. So these are some of the items as examples that load onto that, that factor. And I'm relating them here to the symptoms listed on the DSM, okay, so you can see actual examples of what the DSM is talking about. So when the DSM talks about ideas of reference, you know, these are some of the items that we use to measure this. So, you know, when you see something on TV, do you feel as though it has a social meaning, a special meaning rather for only you? When you see people talking, do you wonder if they're talking about you? Odd magical thinking, so thinking that you can tell what other people think, some unusual beliefs like, you know, maybe contact with UFOs. Unusual perceptual experiences, some items to do with this are hearing voices, speaking your thoughts out loud. And when you look at yourself in the mirror, seeing a sudden change right before your eyes. And then some to do with suspiciousness, right? So you're sure that you're being talked about behind your back. You feel as though you have to be on your guard even when you're with friends. So that's the first factor, these cognitive perceptual issues. The second factor is to do with interpersonal deficits. So we're talking here about people finding you to be aloof and distant, that you very rarely laugh or smile, that you prefer to keep to yourself, and you don't like attaching yourself to close friends, feeling very uncomfortable in social situations. So this is the severe anxiety aspect. And then these suspiciousness items also, okay, they load onto the first factor and onto this second factor. And then a disorganized factor, okay, which is to do with the odd speech, the odd eccentric behavior. So when you're rambling, you're not really coherent in conversation, but people think of you as a bizarre person, unusual person, odd appearance, and other similar characteristics. So when we give this self-report questionnaire of schizotypal personality disorder characteristics, we can make a comparison between controls, so non-offenders, and then offenders. So this is one sample of 1,300. And what we find is that the criminals score higher in all 3 factors, okay, significantly so, both in the male sample and in the female sample in this study. So, like schizophrenia, it does seem as though that the offender population score higher in these schizotypal related personality characteristics than controls. But let's keep in mind that in this study, it's self-report crime, okay? That's what we're using in order to split them into criminals or non-criminals. But if part of this personality disorder is about delusional thinking, then maybe it's the case that self-reports are not entirely accurate, right, for this particular sample. So there was a follow-up done this time, instead of taking their word for it, only using official crime convictions, okay? So again, this time we're comparing controls and criminals. Again, the criminals are scoring higher on each of these factors, but the difference is smaller, okay? And in fact, the first factor difference is non-significant, okay? The other two are statistically significant differences, but smaller than when we were going with self-reports. So it does seem as though the inaccurate self-reports were somewhat responsible for part of the gap, but there is still some difference, okay, even when we're looking for more reliable sources of splitting them to offenders or not. Yeah, we can.
Is this also like Rain also did this study?
Yeah. So, why is it that mental illness, particularly schizophrenia, and maybe schizotypal here, is associated with crime? We looked at a number of factors on Tuesday, right? The fact that there's some overlapping risk factors to do with, for example, deficits to the frontal lobe that I'll elaborate on a bit more. We also talked about the fact that those with schizophrenia might be quite committed to delusions, right? They may have quite paranoid, suspicious thinking as well, might all of that predispose them to criminal behavior. But particularly, let's focus on the idea that they're more likely to be victims themselves, okay? Which was also something I brought up on Tuesday. But, in this study, a quarter of mentally ill people had been the victim of a violent crime in the past year. They're 11 times more likely to be violent crime victims than the general public, 60 times more likely to have their property stolen than the general public. So, more likely to be victimized themselves, okay? And as I'll elaborate on, it's not just when they're adults, but also when they were children, it was more likely that they would have been bullied, ostracized, picked on by their peers, and so on, which also might have caused impairments for their social skill developing. But also we looked at the fact that a number of these disorders are linked to prefrontal cortex dysfunction, right? Which comes with it lower IQ, impairments in executive function, early motor deficits, memory impairments, disinhibition, poor impulse control, right? A lot of the things that we've looked at that are found often in criminals. Quite often also malnourishment during early development, birth complications, disruptors to fetal development that are evident through minor physical abnormalities, and then also differences in their skin conductance, meaning that producing less sweat when feeling anxious or fearful, okay? Their arousal levels are abnormal. So focusing on how much being a victim oneself has to do with the increased likelihood of crime. This is a sample of nearly 4,000 school children from Hong Kong. We're measuring aggressive behavior, okay, through reactive and proactive aggressive behavior. And then we're also giving them a chilled version of the schizotypal personality questionnaire, okay? And what the results found was that, yes, there was an association between schizotypal personality and aggression, meaning that the higher they were in schizotypal personality disorder characteristics, the higher they were in both reactive and proactive aggression, okay? But if we looked at how often they were victimized by their peers, okay, this explains 60% of the relationship, okay? So if that was controlled for, then the relationship between schizotypal and aggression would go down by 60%, okay? 60% of the relationship is being explained by this one factor, okay? The fact that those with more schizotypal personality characteristics are more likely to be victimized, okay, by their peers. We know from the broader research that being victimized by one's peers during early social development is already an increased risk factor for increasing the likelihood of overt physical aggression and a conduct disorder. It means that one isn't privy to the social skill development that comes from being part of a group. Learning to pick up on social cues, learning how to express yourself appropriately, learning how to resolve conflicts successfully and appropriately, and so on. Okay, developing empathy as well. So that largely is responsible, okay, for this connection between schizotypal and aggression. That still leaves, of course, 40% unaccounted for. It might be that there's somewhat of a direct relationship, okay, helping to account for that other 40%. So maybe, you know, paranoid, suspicious beliefs, okay, directly going into aggressive behavior. But can you think maybe of any other potential mediators that might also help explain the connection between these two variables? So what might, other than being a victim, what else might having higher schizotypal characteristics increase the likelihood of, that then also would increase the likelihood of acting aggressive?
Don't they say that there's like a connection between the childhood diagnosis of autism and schizophrenia?
So autistic characteristics as a child,
Yeah,
and most likely because there's some overlap in terms of finding it difficult to attach to others, quite often preferring one's own company. I don't know statistically how much the overlap is, but it makes sense that there's some overlap. How do you think that would help build the bridge?
well, if they're also picked on, it could increase aggression, and so the three just continue to spiral.
Okay. Yep. Anything else?
Like at school or whatever, like if they have a harder time, like already, it's like if they get disciplined more at school, it could go into like being an outcast, not
Okay.
necessarily like being a victim, but just like being separated, not
Yeah.
necessarily bad or good, just like different.
Yeah, okay. Maybe because they have more of the teacher's attention on them and the more closely monitored, maybe that means more ostracized. Yeah, that's a good one.
Or being taken out of class or something.
Yeah. Yeah, that's a good one. Anything else? Yeah, it may not have an impact just on being a victim, but maybe also on how other people relate to them, how other people communicate and interact with them, including other peers, maybe even their parents and so on. And then it might, you know, lead to, for example, a hostile attribution bias, in which you assume people have, you know, a hostile intent towards you, even though they don't. And some other biases as well that might also then play into an increased likelihood of aggression. And then another disorder I want to mention is autism. A disorder in which the symptoms are usually recognized at around age 2. Like ADHD, it's a disorder that's increasing in prevalence, right? According to the CDC, about 1 in 150 children had it in the year 2000. By 2012, 1 in 68, and then by 2014, 1 in 59. Now, much like ADHD, it's a bit of an open question as to why the rates are increasing. It could be, you know, of course, partly due to the fact that people are more aware of it, that there's more diagnoses, but also there's differences in stimulation and development experiences as well. It's 4 times more common in boys than in girls, and the symptoms are typically more severe in boys in comparison to girls who have it. In terms of diagnosing it with the DSM, there must be deficits in one's social communication, one's ability to interact with others, quite often restricted, repetitive behaviors. You know, quite often they like routine. There's repetitive activities that they're interested in, like a small maybe area that they like to talk about a lot or that they like to be involved in quite a lot. Present in early development, but then once one is older, as an adult, it can also cause impairments in their ability to do their job, their ability to have healthy relationships, and so on. Now, there's a number of sources finding that there is some association between autistic characteristics and aggression. In one sample, over 1,500 children between 2 to 17 with autism, 53% of them matched this definition of being currently physically aggressive. So this could be hitting others, kicking others, biting others, so on, any marker of physical overt aggression. And it's also pretty prevalent in institutions. So in a sample of over 1,300 mentally ill offenders, so these are offenders who have committed a crime, and then instead of being sentenced to prison, right, they've been found not guilty because of some insanity. And then they've been sent to a psychiatric hospital until it's found that they're no longer a danger to themselves or to others. And 2.4% of them were classed as definitely being autistic, 2.4% of them as being possibly autistic, and only 10% of these had some prior diagnosis of autism. Now, keeping in mind, this is in the late 90s, right, in which the base rate for autism in the general public was much, much lower. But also, you know, when we talk about the association between mental illness and crime, obviously an important point to remember is that those who are in prison and coming into contact with the criminal justice system, they're more likely to come into contact with mental health professionals as well, so are more likely to be diagnosed with conditions than the general public. But reminder, we looked at a longitudinal study on Tuesday that shows that these increased rates of mental disorders are still already there in the criminal population, even before that they've committed their crime. Asperger's, I'll come to talk a bit more about the difference between autism and Asperger's, but for now, think of it as a more mild form of autism. In Broadmoor, which is a psychiatric hospital in London, in which, again, people are, you know, made to stay there until they're no longer a danger to themselves or to others. Those with Asperger's stayed on average more than 11 years longer than those without Asperger's. So before I go on, what do you think might be explaining some of the association between autism and aggression? Yeah, we can.
People like not understanding what they're trying to communicate, or like them not understanding what someone else is trying to communicate to them, and it becoming like a frustrating situation.
Right, okay, so it can be frustrating not to be able to express yourself, have people understand you. Yeah, anything else? And then you also said, McKenna, they may not understand what other people are thinking, what other people are expecting, which is to do with an impairment in empathy and a difficulty being able to take on the perspectives of others, right? Developing theory of mind. So they do typically struggle with awareness, okay? Awareness over how they come across, how to interact in social situations, how to anticipate other people's feelings and reactions to their behavior. And there's really two forms of empathy, right? There's affective empathy, which is feeling something for someone else, right, that they're going through. So for example, you know, I see a small child being chased down the street by a big dog, and maybe that, you know, causes me some negative emotion or some anxiety, you know, for that child. Or maybe I see some children running around having fun, and then that kind of, you know, makes me feel a bit more cheerful. So it's actually, you know, feeling something for someone else's experience. And then there's cognitive empathy, right? Which is about being more able to put yourself in someone else's shoes and understand where they're coming from. So if someone is angry with me, can I understand why they're angry? Can I understand their point of view? If I'm talking to someone, can I tell when they're interested in what I'm saying versus when they're completely, you know, disinterested in what I'm saying? So Baron Cohen's probably one of the best known researchers in the field of autism. And the way that he describes the difference between autism and Asperger's is that those with autism are low on both cognitive and affective empathy, okay? Whereas those with Asperger's, they're low on cognitive empathy, but they have normal levels of affective empathy. And, you know, just out of interest, psychopaths, by the way, are the opposites, okay? Normal levels of cognitive empathy, but low levels of affective empathy. And then a number of other studies also found, you know, using various operationalizations of empathy, general empathy deficits, okay, in those with autism. And then another disorder to mention is borderline. Probably the next most frequently one tied to criminal behavior after schizophrenia, particularly for female forensic samples. So the DSM characterizes this as a pervasively unstable series of relationships, unstable self-image, impulsivity, and begins in early adulthood. So we have 5 or more of these symptoms that should be present, okay, in order to make a diagnosis. So, frantic effort to avoid real abandonment and also imagined abandonment, intense, unstable relationships, identity disturbance, impulsivity, suicidal behavior, okay? Now, one example of this, I'm going to come back to, is Eileen Bordos. But a number of studies have shown the connection, okay, between violence and borderline. So in the general public, the base rate is about 6%. It's one of the most common personality disorders, particularly in females. So 75% of those with borderline are female. And there is some increased likelihood of having borderline if your parents also have borderline. There is some evidence of heritability for it. But in offenders, the base rate ranges from about 25 to 50%, associated with aggression in a number of studies. I've told you that conduct disorder is often seen as a precursor, a predictor to antisocial personality disorder in adulthood. Well, ODD in childhood is the disorder, okay, that then most predicts having borderline personality disorder in adulthood. In one study, it was found to mediate the relationship in girls between having been abused as a child and then being a violent individual themselves once older. And it's been found to be tied more to reactive aggression than to proactive. Okay. So how many of you know the case of Eileen Bornos? Some, yeah. So probably the best known female serial killer in the US. The Monster movie is based on her life. Her father was a career criminal, raped her when she was 7 years old, committed suicide in prison. Her parents separated before she was even born. A very, very rough upbringing. Okay, her mother abandoned her twice in the first 2 years of life. So during that critical period that we've already talked about. She was mainly raised by her grandparents who were both alcoholics. She was physically and emotionally abused. For example, said, you don't deserve to live. Some disagreements on this, but some accusations that she was raped by her brother when she was a child. When she was 11 and 12, she would do sexual favors on the playground in exchange for cigarettes, giving her the nickname Cigarette Pig, and she was also known to set fires. She gave birth at 14. The child was taken away from her. She did poorly at school. She was a prostitute and an alcoholic for 20 years, likely raped and abused several times during this period. And she was found to score high in psychopathy, have antisocial personality disorder, and borderline personality disorder. Killed 7 people, and 6 of them have been tied to a fear of abandonment that she felt right before the killing. Now, what I'd like you to do in your groups again of 2, 2, and 3, see if you can find evidence of 9 or at least some of these symptoms of borderline in Eileen's case. So you can use this slide as a starting point, but you can also look up further details yourself online. And then find a piece of evidence, okay, to back up if you think one of these symptoms is present. So if you think that, yes, this would apply to her impulsivity, then try and think or find an example, okay, that backs it up.
And we can use that slide or.
You can, and then also you can look up things of your own. So one disorder left to talk about, which is dementia, which is, of course, an umbrella term for neurological disorders. They're all about the kind of mind deteriorating. Alzheimer's is one of the most known, comes with it, pretty severe memory impairment that gets progressively worse, and starts with the hippocampus being impaired. A more maybe extreme version of dementia is frontotemporal dementia. which is about the deterioration of the connection between the frontal lobe and the temporal lobe. So remember, the temporal lobe is where the limbic system resides, right? It's responsible for basic emotions, animalistic desires, and all those kind of more basic, primitive emotions and so on. Whereas the frontal lobe, remember, is the part of the brain responsible for more sophisticated thinking, impulse control, successful planning, decision-making, thinking clearly, and so on. And we've talked about the fact already that the frontal lobe is kind of like a lid, right, on those more basic emotions, stopping your anger taking over, for example. So it shouldn't be then too surprising that if we find that the connection between these two lobes deteriorates, that we find then socially inappropriate behavior, impulsivity, being emotionally indifferent to others and to one's environment, disinhibition, and then a lack of empathy as well for others. Now, some researchers have then investigated just how tied this particular dementia might be to criminal behavior. So what they did was they looked at a hospital of nearly 2,400 patients. It's a hospital that specializes in neurological disorders. And then they've looked at how many of them have a criminal record. It's about 400 to 500, okay? And then looking within this sub-sample of the sample, how many of them have these dementias? So about 8% of them nearly have Alzheimer's who have committed a crime, and about over 37% of those who have committed a crime have frontotemporal dementia. A few years later, the researchers replicated the research design on another sample to see if it would be the same findings that we found, or if it's just a one-off because of that particular institution, that particular sample. But similar results, okay? In this case, same design, right? So they've looked at the sample and then how many have a criminal record, how many of those with a criminal record have Alzheimer's, this time about 15%. How many have frontotemporal dementia, this time about 42%. And then within that sample, we also then looked to see how many had committed more than one crime, okay? So this is a sub-sample of the original sample, right? So how many have committed at least 2 crimes? In this case, 53% of them have Alzheimer's, 89% have frontotemporal dementia. So of course, some of them have both, okay, which could also occur. So the conclusion then was that frontotemporal dementia is the dementia most tied, okay, to increased likelihood of criminal behavior. Yeah, Kayla.
Was age like controlled for this study? Because I don't know, when I think of Alzheimer's and dementia, I think of older people, but I know you can have it onset, early dementia.
Sure.
You know what I mean?
I don't know if they controlled
Okay.
for age. Yeah.
Cause I don't see my grandma committing it. You know what I mean? I just think of older people. That's fine.
Yeah. Yeah. I mean, it depends upon the crime, right? I mean, elderly people with dementia can be somewhat
Yeah.
aggressive, right, when they're
Mhm.
confused and so on.
Yeah.
But you're right, there might be certain crimes that are kind of more limited
Okay.
to commit than younger people. Okay, so I've covered a fair bit this week. We've looked at the fact that recidivistic crime probably does technically meet the requirements of a disorder, but that's not a popular perspective. We've looked at the fact that mental illness is highly prevalent in the criminal population in comparison to non-offenders, and that there is some longitudinal studies that show it predates criminal behavior as well. The ADHD might be linked because of impulse control issues, that it coexists pretty often with CD and ODD. Schizophrenia, schizotypal also tied, maybe because of their increased risk of being a victim. Autism, maybe because of the lack of empathy. Borderline, because of impulsivity, paranoid behaviors, paranoid thinking, quick to anger. And then increased rates of frontotemporal dementia, okay, in samples as well. Any questions on anything I've said this week or on your presentations that are next week?